This is in regards to a tube feeding for a 35-year-old male client who will be going home with his mother and father, and they will be his primary caregivers, and they're going to be responsible for the administration of his feedings at home via a G-tube. History is David Wilson. He's 35 years old. He has drug addiction. He was suffered a brain injury after a heroin overdose a week ago, and he was unconscious for 5 days and then regained consciousness, but now has self-care deficits requiring the help of his parents. The orders read: assess the client every 4 hours, assess G-tube every 4 hours prior to feeding and check placement, assess residual every 4 hours prior to next feeding, replace residual fluids, administer 400 mL of tube feeding over 10 minutes via bolus every 6 hours, flush with 30 mL of water, hold tube feeding if the residual fluid is over 200 mL, and reevaluate the residual after 1 hour. Bolus feeding can resume when residual is less than 100 mL, and he is going to be weighed weekly. Mr. and Mrs. Wilson, my name is Christy, and I am going to be going over David's returning to home with you. You are going to be administering bolus feedings via the G-tube every 4 hours. I'm going to go over this step by step with you and tell you exactly what you need to do. Are you ready to begin? Okay. The first step is that you will begin with all your supplies at bedside. You are going to need a 60 cc syringe, formula. Be sure to wash the top of the can and wipe it clean, and at least 2 cups of room temperature water. You may not use all the water. You can discard what you do not use. You are also going to need a stethoscope. You're first going to wash your hands. You will be checking for placement prior to starting your tube feeding. This is done by placing a stethoscope near the G-tube and pushing a puff of air into the G-tube, and to be sure to listen with the stethoscope for the sound of the air through the stethoscope near the stomach. Make sure that the tubing being used is primed so that no more air enters the stomach. You will attach your 60 cc syringe to the end of the G-tube, plunger in place. You are going to pull plunger back. This is going to check for any residual fluids in the stomach. If the residual fluids are less than 200 mL, push the plunger to return the residual fluids to the stomach. If the residual is more than 200 mL, hold the tube feeding and check again in 1 hour. Ensure that your clamp is on. You are going to pour 30 cc's of room temperature water into the 60 cc syringe that you've attached to the tube. You're going to release the clamp and ensure the tube is working properly. You're going to put the clamp back on and make sure the line is free of air. Now you're going to take the formula can that you have cleaned and opened prior to the feeding and fill the 60 cc syringe. You're going to release the clamp and allow the formula to enter the stomach. You will continue to fill the syringe 6 to 7 times until 400 milliliters of the formula has been administered. Ensure that you are clamping in between filling, or you can do a continuous flow, filling and not allowing any air to enter the stomach. Ensure, once complete, you're going to put your clamp on, flush the tubing with 30 cc's of room temperature water again, and then you are going to replace the clamp and the feeding port closure. You're going to wash your hands and remove your supplies. Do you have any questions, Mr. or Mrs. Wilson?